Hi, good afternoon to most of our attendees and good morning to those on the West Coast. My name is Tracy Mitchell. I'm a respiratory therapist, a certified asthma educator, and an environmental protection specialist for the Indoor Environments Division at EPA in Washington, D.C. The Indoor Environments Division is where we promote environmental asthma management and healthy indoor environments as critical components of comprehensive asthma care. I'm pleased to welcome all of you to our webinar series, Solving for Indoor Environmental Determinants of Health, or IEDOH, in asthma, where today we will explore IEDOH solutions for asthma during wildfires, when indoor air interventions are treatment for acute risk of exacerbation for people with asthma. Next slide. We have a lot of great information for you today. Over the next 90 minutes, you'll learn that wildfire smoke prevention exposure has increased and is driving asthma attacks and ER visits and hospitalizations, sometimes very far from the source of the fire. You'll also learn there are many ways communities can prepare for risk of wildfire pollution exposure by focusing on people and housing with disproportionate asthma and air pollution exposure risk. And you'll learn communities facing wildfires in California have practical examples to share on delivering indoor environmental interventions as prevention and treatment of acute asthma risk in wildfire smoke events. So our goal today is to help all of you who are working in asthma programs recognize the need to prepare for wildfires and asthma spikes wherever you are, because unfortunately, wildfire smoke prevention prevents a significant risk for people with asthma, and some of the best opportunities to address the risk focus on indoor air and environmental asthma interventions. The information we spotlight today looks at the indoor environmental determinants of health solutions for children with asthma, particularly disproportionately affected children. But the solutions we will discuss today, the indoor environmental determinant of health interventions during wildfire smoke, can really be adapted to help anyone. After all, no one is safe when wildfire smoke is outdoors. Our intent is that you will leave this webinar with a better understanding of the solutions for asthma in our communities to prepare for and respond to wildfire pollution. So on the next slide, let's begin by looking at our audience today. So you can see here a map that reflects our registration numbers. We had almost 600 registrants for today's webinar. And as you see on the map, the darker the shading is the more attendees and registrants we have represented in our audience today. So as I said, we had over 600 registrants. We had great interest in this topic, and especially for those on the West Coast and in many parts of the country. We're dealing with wildfires, right, in many states, in many communities. So thank you for your participation. We have great representation across the country, and we're excited to share this information with you. So on the next slide, before we begin with the presentation, I'd like to ask our audience to help us out with this polling question. So we'd like to take a quick assessment about how knowledgeable you feel when it comes to the discussion around asthma care in wildfire polluted environments. So let's open the poll, and please pick the one response that best describes your current understanding, specifically regarding wildfires and asthma and indoor environmental determinant of health solutions. While you're answering, I will just let you know that we will repeat the poll at the end of the presentation in an effort to see if we met our learning objectives. So thank you for participating now, and thank you in advance for participating after the presentation. As you're filling out the poll, we'll keep it open for a few more seconds. I'll ask you during the presentation, if you have questions, please use the chat function. And we will collect those questions and have an opportunity to address them at the end of the presentation. I'll also just remind you, this presentation will be archived and available on AsthmaCommunityNetwork.org in a couple of weeks. So here's our poll results. Thank you. Looks like we have some folks who are very familiar, but the majority are somewhat familiar, and looks like we have some folks who really don't feel like they're very familiar at all with the subject. So thank you again for being here. I think we have a lot of great learning for you today. Next slide. So I want to talk about EPA's work before we jump into our presentation. So at the United States Environmental Protection Agency, we've been working to build capacity with communities to address the indoor environment as a standard part of asthma care. We've focused on reducing the role of the environment in asthma disparities because we know low-income and minority children are disproportionately affected by asthma, with worse outcomes from harder to control asthma. Unfortunately, these are the same children. They're often covered by Medicaid, and they're unfortunately more likely to live in substandard housing with more exposures indoor and outdoors. And those exposures can worsen asthma health outcomes. The Indoor Environments Division, where I work, has always tracked asthma disparities and focused on reducing disparities because asthma disparities spotlight the critical role for in-home environmental interventions in asthma care. But today we're here to talk about indoor interventions as critical care in acute asthma risk situations, specifically in wildfires, when solving for indoor environmental determinants of health in asthma becomes critical and urgent health care. In wildfire situations, when smoke travels many hundreds of miles, polluting outdoor air, for children with asthma and people with other respiratory disease, indoor environmental asthma interventions, like the use of indoor air cleaners, becomes emergency medicine. I want to say that again. Indoor environmental asthma interventions becomes emergency medicine. Wildfires truly bring into focus the critical role of in-home environmental determinants of health, or IEDOH, and their interventions in asthma. So on the next slide, before we go any further, I want to make sure that we're all speaking the same language. We all understand the terminology we're using today. When I say IEDOH, hopefully, if you've been on any of EPA's recent asthma webinars, you're familiar with this term. But let's just take a step back. Many of you have probably heard of the social determinants of health, SDOH. That terminology is now very common across sectors, particularly public health. It's also widely used in healthcare and housing, environmental and energy, and in community development sectors. So social determinants of health are conditions in the environment where people are born, live, work, play, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So as you see on this infographic, and this infographic is based on a scientific literature review and is aligned with the Department of Health and Human Services Healthy People 2030 initiative and the World Health Organization's definition of the social determinants of health. This infographic shows that the social determinants of health are grouped in 5 categories and offers a way to visualize the social determinants of health and to estimate each category's relative contribution to health overall. In EPA's Indoor Environments Division, our asthma work, we encounter the social determinants of health terminology frequently because our mission really sits at the social determinant of health intersection where asthma disparities and poor quality housing co-vary. The term indoor environmental determinants of health, or IEDOH, focuses where our mission lives within the social determinants of health and underscores the reality that homes and buildings and their corresponding indoor environments where people spend 90% of their time can either degrade or promote everyone's quality of life and disease outcomes. On the next slide. So if we zoom in, go ahead and click, please. As we zoom in, we see that the IEDOH, the indoor environmental determinants, are a subset of the social determinants of health. And they're clustered in the physical environments that vary with housing quality and access to quality medical care. We can see that people with limited access to quality medical care are likely to also have limited access to quality housing and to be disproportionately exposed to harmful indoor environmental determinants of health in their home and in other community settings and environments. This is particularly true in wildfire events, where poor environments can either create safeguards against risks or can invite and amplify risks. In wildfire smoke events, the same children who are disproportionately at risk of environmental exposures due to substandard housing are the same children already likely to experience asthma disparities. They start out at risk of exacerbation even before added wildfire smoke exposure. EPA draws focus on the indoor environmental determinants of health because they are the modifiable indoor environmental factors that influence human risk and experience of disease, including asthma. So again, these are modifiable indoor environmental factors. For example, things like household air pollution, temperature variations, pests, mold and moisture, chemicals and irritants, and our focus today, infiltration of wildfire smoke. So evidence shows that the indoor environmental determinants of health in the physical environment, the green section here that you see on this graphic on the screen, and the determinants of health highlighted in medical care, which is in the pink, together are key drivers of asthma prevalence and outcomes. So in other words, where IEDOH and SDOH cluster and converge, like in poor quality housing, asthma outcomes are worse. In fact, in this close-up view of the IEDOH, we see multiple compounding drivers of asthma health outcomes and disparities. This view really highlights the opportunity with in-home environmental interventions to improve asthma health outcomes and potentially reduce disparities. We see that people likely to have limited access to quality medical care are also likely to have limited access to quality housing and are likely to be disproportionately exposed to harmful IEDOH, like infiltrating wildfire smoke. Knowing this creates focus and opportunities for research and interventions, and that's what EPA highlights when we talk about IEDOH and address it in our program. This view also suggests multiple pathways for protecting health in homes, from structural prevention built into housing, like building envelope sealing and insulation, to access to in-home asthma care with tailored environmental counseling and supplies. When we look through the IEDOH lens, we see that all home-based healthcare and all structural housing offer chances to address the IEDOH and to substantially improve related health outcomes, particularly in asthma, but not just asthma, in other health outcomes as well. Next slide. So today we'll hear about the possibilities for home-based asthma education and IEDOH interventions, support, and supplies for people at risk of asthma exacerbation when outdoor air poses an acute threat, which is an increasing reality for all of us, unfortunately. As we move to our presentation, let me paint a picture about who most needs indoor environmental determinant of health solutions during wildfire, with data which you can find on EPA's website in our wildfire smoke course. While everyone in a region will be exposed to smoke during a wildfire event, the impacts are not experienced equally. As you can imagine, children, pregnant women, people with underlying health conditions like asthma and other chronic lung and heart disease, and other vulnerable groups are at the greatest risk. Next slide. Extensive epidemiological evidence shows that emergency department visits and hospital admissions for asthma spike during wildfire events. Here's a CDC public service announcement from their Morbidity and Mortality Weekly Report, publicizing the evidence captured last year during wildfire smoke events and counseling asthma patients to prepare with clinical guidance and N95 masks. Next slide. Here's another view of that same data and the message communicated by CDC. Here we see spikes in emergency department visits during a June 2023 wildfire smoke event that you may remember from in Eastern Canada. This event drove increased concentrations of PM2.5 across New York State, and that was linked with increased asthma-associated emergency department visits across New York, with a twofold increase in the Eastern Lake Ontario and Central regions, and a nearly threefold increase among older children and young adults. So next slide. So we know that this is a growing nationwide problem, the risks from wildfire pollution, and that the PM2.5 released in wildfires is associated with significant spikes in urgent healthcare visits. Now let's focus on solutions. Solutions which reduce exposures to spiking PM2.5 from wildfire. And this means indoor solutions where we can condition, vent, filter, and treat the air. We know that children with poorly controlled asthma are at significant risk. We can see how preparedness with data on where those children are located, equipment to clean their air, and community networks ready to deliver IEDOH solutions during wildfires are key. Today, we're very lucky to hear from someone who's been on the front lines of every step in such an effort in the Oakland, California area through the Public Health Institute's Regional Asthma Management and Prevention, or RAMP. So reflecting on my earlier points about the overlap in asthma disparities and disproportionate healthcare use and spikes in emergency department visits in wildfire events, we'll learn how to prepare for wildfires and partners like state Medicaid for financing of air cleaners and staff for home visits for children at the greatest asthma risk. So with that, I'm honored to introduce my colleague and our speaker from Oakland, California, Ann Kelsey Lamb. Ann has a master's in public health and is the director of Regional Asthma Management and Prevention, RAMP, a project of the Public Health Institute. Since 2002, Ann has led RAMP asthma efforts that emphasize prevention and management of asthma by building asthma program capacity, linking programs in networks, and mobilizing networks to address the causes of asthma disparities through housing quality, affordability, and tenant protections. The organization RAMP also works on policies to reduce air pollution in burdened communities, increasing access to prevention in healthcare, and asthma workforce development, among many other initiatives. Today, Ann will share with us about RAMP's 2023 work with partners to pilot a program to provide free air cleaners, indoor air cleaners, and asthma education to Bay Area community members most susceptible to the impacts of wildfire smoke, to evaluate those efforts, and then to coordinate between Medicaid payers and disproportionately affected people with asthma and their caregivers to match much needed community IEDOH solutions. So with that, it's my privilege to turn over the presentation to Ann Kelsey Lamb with RAMP. Welcome, Ann.
Thank you, Tracy. It's an honor to be here. Oh, I am getting an echo. I think if we have you mute, Tracy, that'll help. Good. All right, is that better now? Yes, fantastic. All right, it's great to be here to talk about this important topic. Let's go ahead to the next slide. And I just want to briefly share, for those of you who are not familiar with RAMP, our mission is to reduce the burden of asthma with a focus on health equity. We don't provide direct services to people with asthma, but we support those who do. We build capacity through providing tools and technical assistance. We bring people together for peer learning and network development, and we mobilize our networks for policy and systems change. As Tracy shared, we are a project of the Public Health Institute based in Oakland, California. So during today's presentation, I will describe guidance that we developed for selecting air cleaners for people with asthma. I will share tools for asthma programs, government agencies, and consumers, and I will discuss some best practices for distributing air cleaners to people with asthma. Next slide, please. So why are we talking about air cleaners today? Over the past several years, we have seen an increase in the number, size, and frequency of wildfire smoke events here in California and neighboring states. As of this morning, 11 states have wildfires burning right now. And as Tracy shared, last year, as much of the East Coast was blanketed in smoke during the wildfires in Canada, we saw that the growing threat of wildfire smoke is not unique to Western states. Air cleaners with HEPA filters are very effective at reducing particulates and creating cleaner indoor air during wildfire smoke events. Yet they are often prohibitively expensive for low-income families with asthma. And even when asthma programs can provide air cleaners to their clients, it can be difficult to navigate the selection to ensure that you're providing safe and effective air cleaners. Today, I'll talk about ways that we at RAMP have worked to address both of these challenges. Later in the presentation, I'll describe a program through which families with asthma were provided free air cleaners. This slide shows a quote from one of the participants, really driving home the reason we're doing this work. All right, next slide, thank you. So any of you who have gone through the process of buying an air cleaner yourself know that there are many, many air cleaners to choose from. And there are many factors to consider, just some of which are listed on this slide. And unfortunately, not all air cleaners are equally safe and effective. So we at RAMP, in partnership with Dr. Gina Solomon, who is the Chief of the Division of Occupational, Environmental, and Climate Medicine at UCSF, developed guidance for asthma programs on selecting air cleaners. We began our process by interviewing 16 air quality and engineering experts, including representatives from the US EPA, California Department of Public Health, California Air Resources Board, Lawrence Berkeley National Lab, Research Triangle Institute, and Illinois Institute of Technology, to name a few. We talked with them about which technologies are safest and most effective, as well as other considerations to ensure that air cleaners are effectively improving indoor air quality. We also conducted focus groups with 20 community health workers, promotores, and others who provide asthma education to families in their homes in communities across California. We heard from them about what considerations related to air cleaner use are most important to the families they serve, including such things as size, portability, noise level, and the cost of replacement filters. Through that process, we developed the following guidance. Our first recommendation is to make sure the air cleaner is certified as a mechanical air cleaner by the California Air Resources Board. There are two broad categories of air cleaners. Mechanical air cleaners are safe and effectively filter out particles using HEPA filters or similar filters. Electronic air cleaners using ionizers, electrostatic precipitators, PCOs, hydroxyl generators, and UV lights rely on technologies that can produce ozone or other byproducts harmful to health. Researchers at the University of California, Davis recently released an in-depth report commissioned by the California Air Resources Board, noting that, quote, compounds of clear concern are ozone, formaldehyde, and ultrafine particles, which were widely observed across studies from the use of electronic air cleaners, end quote. The California Air Resources Board certifies air cleaners that emit less than 50 parts per billion of ozone, which is a good start. But research shows that even extremely low levels of ozone exacerbate asthma. So we recommend only using mechanical air cleaners for your clients with asthma because they emit no ozone. It's not always easy to tell whether an air cleaner is mechanical or electronic by looking at the product description. So we recommend going to the California Air Resources Board website at the URL on the slide. You'll see that they list all of the air cleaners that they have certified. You'll see that there is a column called Type, which will indicate whether the air cleaner is mechanical or electronic. Again, we recommend selecting mechanical. The list is long and in alphabetical order by manufacturer, so you can either scroll through or you could search by brand or model name using the search function in the upper right. Next slide, please. Our second recommendation is to choose an air cleaner that is the right size for the space where it will be used. Air cleaners are made to clean different sized rooms, so it's important to use one that is powerful enough to clean the amount of air in the room where it will be used. The Clean Air Delivery Rate, or CADR, tells you how much air the air cleaner cleans hourly. This is measured in cubic feet per minute. We recommend using an air cleaner with a CADR up to around 200 cubic feet per minute for a small room, around 300 for a medium room, and more than 300 for a large room. Next slide, please. There are many other considerations to weigh that were raised by the air quality experts and the community health workers when we spoke with them. The first is cost. Air cleaners and replacement filters are expensive. So we encourage agencies and organizations to provide air cleaners to community members when possible. I'll talk more about that later, but you can find effective air cleaners for $250 or less. You'll also want to find out the cost of replacement filters because they can vary quite a bit. If your program is unable to buy air cleaners, you can inform your clients about less expensive options like the do-it-yourself box fan, which is also effective. Noise level. Air cleaners work best at their highest fan speed. However, they may be loud. Air cleaners that are above 55 decibels are quite noisy and will be unpleasant for most people. So we recommend selecting air cleaners with a below 55 decibels, even at their highest fan speed. We heard from community health workers that size and weight are important factors because they're often loading up the air cleaners into their cars to bring them to the families to show them how to use them correctly. We also heard that size and portability are important to families who may be living in crowded spaces or who may move a lot, or in cases where a child with asthma spends time at multiple homes and wants to bring the air cleaner with them. Energy efficiency. We know that families are concerned about increased energy usage and cost. The Energy Star label means that the product uses energy efficiently. Independent testing. Some air cleaners have the AHAM, or Association of Home Appliance Manufacturers, certification, which means that the product is independently tested and rated for its ability to clean the air. Manufacturers pay for AHAM to evaluate their products, so an air cleaner may still be good even if it is not certified by AHAM. But if it has been AHAM certified, you know that the CADR is accurate, and that's very important. Other features. Air cleaners come with an array of additional features, such as air quality monitors, indicator lights for when the filters need to be replaced, or a child lock. Knowing what's important to the clients you serve can help you prioritize which, if any, of the features are most important. Next slide, please. We developed a table that includes examples of air cleaners that align with the guidance we provide. It is important to note that RAMP does not endorse any of these products, nor are we suggesting that this list captures anywhere near all of the air cleaners that align with our guidance. Rather, based on independent third-party testing and manufacturer information, these are examples of air cleaners that meet our criteria. The first column lists the model. The second indicates whether it would be best for a small, medium, or large room. Further down the spreadsheet, we list a few that would be good for very large rooms, like classrooms or daycare centers. The next column lists the costs on the day that we develop the table, followed by the cost of replacement filters. It then lists the noise level, size, weight, and whether it has an Energy Star rating. And the final column lists the special features like air quality monitor, filter replacement indicator, and the like. Next slide, please. Perhaps more important than the table, however, are the materials we've developed for organizations and agencies, schools, and consumers on how to select air cleaners. The first image on this slide is how to choose a safe and effective air cleaner for consumers. We also developed short videos to share with clients about how to use and maintain the air cleaners in both English and Spanish. You can see the YouTube images here, and all of these materials and more can be found on our website at the URL listed on this slide. We also developed a tool called Helping Clients with Asthma Prepare for Wildfire Smoke Events, Tips for Asthma Educators. In it, we recommend that you encourage your clients to track the Air Quality Index, also known as AQI, in their local area through the airnow.gov website. An AQI level greater than 100 is unhealthy for sensitive groups, which includes people with asthma, and greater than 150 is unhealthy for all people. We encourage you to encourage your clients to stay inside with doors and windows closed and avoid activities that create more indoor pollution, such as frying foods, sweeping, vacuuming, lighting candles or incense, and using gas stoves. However, if they are experiencing extreme heat along with wildfire smoke, it's not safe to stay inside with windows closed if they don't have an air conditioner or if they lose power. In these cases, they should seek alternative shelters such as a community cooling center. If your clients must be outside during unhealthy conditions, encourage them to wear an N95 mask that can filter out damaging fine particles, but remind them that they shouldn't participate in optional outdoor activities like playing sports, regardless of whether or not they're wearing a mask. And of course, our tip sheet includes guidance about using portable air cleaners and also adding filters to the HVAC system when possible. Next slide, please. The final resource I'll share is a fact sheet for consumers on asthma, smoke, and air purifiers. It is available in English, Spanish, Chinese, Tagalog, Arabic, and Vietnamese. Next slide, please. Thank you. So in addition to providing guidance and educational materials, we need to think about ways to systematically get air cleaners to the people who need them most. So who should be responsible for this? We know that asthma home visiting programs improve asthma outcomes and that asthma home visitors excel at building trust and rapport with families in their homes. Many asthma programs routinely provide supplies like asthma-friendlier cleaning products, dehumidifiers, or HEPA vacuums. We recommend also including an air cleaner and replacement filters when possible. If your asthma program has a grant funding, say from a foundation or a community benefits program, we encourage you to include air cleaners and replacement filters in your budget. But to systematize air cleaner distribution, we see an important role for government agencies, like air quality agencies or Medicaid agencies, as well as organizations including health plans. Such responsibility makes sense for organizations and agencies with a population view of asthma risk in preparation for or during a wildfire smoke event. When we must ration limited air cleaners, it's important to ensure that distribution methods are informed by risk data, ready to deliver through trusted partners to make sure the scarce and urgent healthcare resources efficiently reach those most at risk. In this case, people with poorly controlled asthma and limited healthcare access. To that end, I'm going to describe a partnership with the Bay Area Air Quality Management District to get air cleaners into the homes of low-income Bay Area residents with asthma by partnering with asthma home visiting programs. I'll share opportunities within state Medicaid agencies to get air cleaners to people with asthma, and I'll provide some additional recommendations based on lessons learned. Next slide, please. Thank you. In the summer of 2021, the Bay Area Air Quality Management District approached RAMP about their interest in providing air cleaners to low-income residents with asthma. We recommended that the air cleaners be provided as part of a comprehensive asthma home visiting program by partnering with Bay Area organizations involved in the Asthma Mitigation Project, also known as AMP, which was a grant program that ran from 2020 to 2023. The grant program was funded by the state of California and ultimately served as a model for Medi-Cal coverage of asthma home visiting. Through the grant program, 28 community-based organizations, local health departments, and community clinics across the state received funding to provide home-based, culturally and linguistically relevant asthma self-management education. The asthma home visitors, most of whom are community health workers, also conducted an in-home environmental asthma trigger assessment and then provided supplies and services to help reduce those triggers. 7 of the organizations participating in the AMP grant program are in the Bay Area and agreed to provide air cleaners purchased by the Air District to their AMP clients, along with education about how to use and maintain the air cleaners to reduce exposure to wildfire smoke and other asthma triggers. Through this partnership, the Bay Area Air Quality Management District purchased air cleaners and had them delivered to the asthma home visiting programs. The asthma home visitors delivered the air cleaners to their clients as part of comprehensive asthma home visiting service. They focused on those at highest risk for poor outcomes by using the AMP grant eligibility requirements, which were first, that recipients are those with poorly controlled asthma, as defined by an asthma-related ED visit, hospitalization, or 2 urgent care visits in the past 12 months, a score of 19 or lower on the asthma control test, or the recommendation from a licensed provider. And second, it was for people with the greatest need for health-related resources, which was determined by being a Medi-Cal beneficiary, which is California's Medicaid system. The asthma educators provided education about how to optimally place, use, and maintain the units throughout wildfire season. And they gathered de-identified data about the air cleaner recipients, age, race, ethnicity, primary language, and zip code, so that the Air District could determine whether the air cleaners were indeed reaching the most vulnerable residents and could use the data to shape additional investments. So who did receive the air cleaners? In June of 23, RAMP staff compiled data for the air cleaners that had been distributed to AMP partners at that time. The program collected data on self-reported race and ethnicity. The largest percentage of people, 46%, self-identified as Hispanic or Latino, Latinx, followed by African American or Black with 30%. Next slide. The next chart compares the race and ethnicity of air cleaner recipients, which is the yellow bar, to the race and ethnicity of, first, people with asthma in the Bay Area, which is the blue bar, and low-income people with asthma in the Bay Area, which is the green bar. So, for example, if we look at the first category on this graph, Hispanic or Latino Latinx, the yellow line shows that close to 50% of air cleaner recipients are Latino. The blue bar shows that just over 20% of people with asthma in the Bay Area are Latino. But when we add in low income, the green line shows that over 40% of all low income people with asthma in the Bay Area are Latino. A conclusion that can be drawn from this comparison chart is that the AMP program successfully reached and provided air cleaners to low-income, African American and Latino people with asthma. However, the percentages of white and Asian clients that received air cleaners were lower than the percentages of white and Asian people with asthma in the Bay Area. In some cases, the race and ethnicity of the air cleaner recipients was shaped by the fact that some of the AMP organizations serve specific geographic areas or prioritize services for specific racial and ethnic groups. For example, Roots Community Health Center's asthma program is an African-centered model of prevention and treatment with an emphasis on service to African American families in East Oakland. So in terms of geographic reach, the Air District's jurisdiction includes a 9-county region shown on this map. The stars on the map indicate the location of the AMP programs participating in this partnership. There were no AMP programs serving 3 of the counties, and some of the AMP programs serve just particular cities or neighborhoods rather than the entire county. So even for counties with a red star on this map, in some cases there were portions of the county that did not receive any air cleaners. It is also important to note that the number of air cleaners distributed varied across the communities due to variation in the size of the programs and the number of clients that they serve. This next bar graph shows the age of recipients. The air cleaners were distributed to all age groups, with the largest number being between 5 and 11 years of age. In terms of primary language, the majority of air cleaner recipients, 55%, speak English as their primary language, 29% speak Spanish, followed by 8% Arabic, 6% Cantonese, 1% Tagalog, and 1% Mandarin. Some air cleaners reported speaking Farsi, Vietnamese, or Korean, though the numbers were too small to include in this chart. So the outcomes of this pilot project were an overall success. The air cleaners reached low-income individuals with asthma. The asthma programs were particularly successful in reaching Black and Latino people, as well as people whose primary language is something other than English. Data indicate that these same groups systematically lack access to healthcare, so reaching them through the community with urgent healthcare supplies catered to their circumstances in a situation of peak risk is a significant accomplishment. There were also many lessons learned about the process that will be used to shape future Bay Area Air Quality Management District investments and may also be useful to others interested in replicating this partnership. We developed a case study highlighting lessons and tips. Pictured here is a page from the case study that summarizes the key lessons, and the URL will take you to the full report. So what is around partnerships? We encourage agencies to establish agreements with all participating partners before launching the project and to involve partners in project planning and rollout. For air cleaner selection, we encourage agencies to select vendors and air cleaners through a competitive process with clear health protective criteria and scoring rubrics. We encourage agencies to involve partners in the process of establishing criteria and selecting vendors. And we also encourage providing multiple air cleaners from which partners can select to meet the needs of their organizations and clients, and to always include replacement filters. For orders and deliveries, we encourage agencies to work with programs that will be distributing the air cleaners to establish processes. Some of the programs shared that they didn't have any storage space, so they couldn't receive a large order of air cleaners. Knowing this in advance, the Air District was able to work with the vendors to allow monthly orders to be placed. Data collection. Establish data collection and expectations and protocols upfront and in partnership with the distribution partners. And education. We always recommend providing educational materials in different formats and languages. We have the fact sheets and videos that I shared, and the Air District also created fact sheets on how to use and maintain the particular models that were provided as part of their project. When feasible, provide the air cleaners as part of a comprehensive asthma management intervention. Next slide, please. The Air District Partnership was an example of a government agency allocating funds to provide air cleaners to those most in need. I'd like to share an example of a government agency incorporating air cleaner distribution into their ongoing services through a policy change. California's Medicaid program, Medi-Cal, is administered by the Department of Healthcare Services, also known as DHCS. They have a program called Community Supports through a federal policy known as In Lieu of Services. It allows certain non-medical services to be provided in lieu of traditional medical care in order to help avoid other costlier interventions, like hospitalizations and emergency department visits. DHCS provides a menu of 14 services that Medi-Cal managed care plans can choose to integrate into their programs. Asthma remediation is one of these 14 options, and it uses Medi-Cal funds to cover minor to moderate environmental remediation for beneficiaries with poorly controlled asthma. Asthma remediation can include services like minor mold removal, ventilation improvements, or integrated pest management. It can also include supplies like mattress and pillow dust covers, HEPA filtered vacuums, dehumidifiers, and importantly, air cleaners and replacement filters. The rollout of asthma remediation had a slow start, so we do not yet have a lot in the way of data, but there's the potential to get safe and effective air cleaners into the homes of Medi-Cal beneficiaries with asthma across the state, and for this policy to serve as a model for other states. And I'd like to share that we at RAMP are able to provide free technical assistance to other states that are interested in such policies. Next slide, please. So California is not the only state providing air cleaners to Medicaid recipients. In 2022, Oregon passed state legislation directing the Oregon Health Authority to create Oregon's air conditioner and air filter deployment program to provide both air cleaners and air conditioners to certain qualifying residents. The inclusion of air conditioners is noteworthy because with climate change, we're increasingly seeing both wildfire smoke and extreme heat. On days that both occur, the typical wildfire smoke recommendation of staying inside with windows closed isn't safe when it's extremely hot inside the home. Short of directing people to cooling centers, it's been difficult to identify quick solutions to this immediate threat. Next slide. So I'd like to conclude with some overarching thoughts about lessons learned and recommendations. Air cleaners are important and effective tools for reducing exposure to wildfire smoke, particularly for people who are most vulnerable to the impacts of smoke, including people with asthma. Given that air cleaners can be prohibitively expensive to buy and maintain, the asthma field should pilot and/or systematize and scale an array of programs and policies in order to provide air cleaners and replacement filters to low-income people with asthma. This may include using grant funding or other funding to pilot projects, but should ultimately include policies that systematize investments from government agencies. When designing a program and forming partnerships, there are many factors to consider. A significant advantage of partnering with asthma home visiting programs is that the air cleaners are provided by trusted asthma educators who demonstrate how to use and maintain the air cleaners and provide them as part of a comprehensive approach to asthma management. Yet we recognize that there may be faster ways to distribute larger numbers of air cleaners to community residents, which could be useful during wildfire smoke events and/or with a larger project budget. We encourage asthma programs to continue learning from each other, to test models and identify best practices. And with that, I will close and take questions. Thank you all so much.
Great. Thank you so much, Anne. I really appreciate your great presentation and the information you provided, the really practical and helpful information on air cleaners, and hearing about RAMP's impressive work in California, the partnership with Medi-Cal. And I want to make sure folks heard your offer to provide technical assistance and help to other programs. So I want to emphasize that as well. So as we move on, I want to, before we get to the question specifically, I'd like to invite Kate Hastings, EPA's program, asthma program's longtime facilitator and contractor, to join us now, and she will help guide the question and answer portion of the webinar. She'll facilitate some of the questions we received during the webinar from the audience and facilitate the panel discussion. So thanks, Kate. Take it away.
Hi there, thank you. And I'll ask anyone who's not speaking, who's on the panel, just to mute when you're not speaking, because we heard we've got that little bit of an echo going today. Let me first welcome our panel before I turn and ask Anne a few specific questions about her presentation, and then we'll open it up for a panel conversation. And unfortunately, let me say from the top, unfortunately, we had an unexpected Queen Aze from La Esperanza was unexpectedly unavailable today. We'll talk just a little bit about their program that Queen was going to represent, but let me welcome our panelists who are here. Our panelists today are colleagues in wildfire smoke preparedness who recently received US EPA's Wildfire Smoke Preparedness in Community Buildings grants. Queen, had she been able to be here today, was going to represent an urban and community-based grantee, but we are very lucky. We have both BJ Biskupiak and Mary Anderson from Montana joining us today, and Montana is also a wildfire grantee, and they'll help talk about some perspectives of, a statewide grantee and also a state that's really different from the geography and demographics of what Anne has described. So let me just very briefly share a little bit of background on our panel, and then Anne, I'm going to come to you with just a handful of specific questions about your presentation before the panel can react to what they heard and also what you're thinking about in Montana for the future with your wildfire grant investment. Had Queen been able to join us today, she would be representing Esperanza Community Housing, where she has managed the asthma remediation and healthy breathing program since 2022. Queen has a background in public health and a master's in public health, and she focuses on delivering services to the marginalized, underserved, and folks with limited access to resources. Queen will be overseeing the Wildfire Smoke Preparedness Grant for Esperanza Community Housing Corporation, and one of the focuses of this grant is to protect the people of South Los Angeles from wildfire smoke by strengthening preparedness infrastructure in a central building, the Mercado La Paloma building, and then also using that site to launch grassroots education and outreach. So you heard there will be infrastructure investments in a building. We're also welcoming BJ Biskupiak, and he is from the Montana Asthma Control Program in the Montana Department of Public Health and Human Services. BJ is a public health program specialist, and he manages the Montana Asthma Control Program, or MACP, within the Chronic Disease Prevention and Health Promotion Bureau. BJ graduated from Carroll College in 2010 with a BA in community health, and then he went to Peru for 3 years where he served in the Peace Corps as a community health specialist. In 2013, he returned to Montana and began his work with the MACP. He's also overseen the state health department's response to wildfire smoke for over 10 years. And he'll describe today some of the work Montana has planned with partners that includes tribal partners to increase wildfire smoke awareness, pilot clean air shelter recognition programs, piloting starting in hopefully 6 sites, and creating culturally appropriate messaging. And also joining from Montana today is Mary Anderson. And I really like Mary's story, really is very touching to me, so I have to share it. Mary served as a school counselor, and later she was a training coordinator for the Department of Justice prior to becoming a wildfire smoke coordinator with the Department of Public Health in the state. And though she worked really closely with school nurses and administrators in developing accommodations for students with asthma under Section 504 plans, for example, she says now she recognizes her lack of knowledge about wildfire smoke risk at that time as somewhat alarming. So she's very excited to be in the position she's in now, to have the opportunity to train and provide resources to her former colleagues. So with all of that, excuse all my talking there, ladies and gentlemen, welcome. We're glad to have you. And now, Anne, I'm going to ask you some questions specific to the pilot you described before we open up and have a chat. So I'll start with the easy questions. Somebody asked, you described air cleaners for small, medium, and large spaces. Can you tell us what a small, medium, or large space is? Did you have a square footage?
Let's see, how do we figure that out? We said up to around 200 cubic feet per minute. Well, that's for the CADR. But I think picture a small bedroom. So then you would want up to 200 CADR. Maybe a larger bedroom would be up to 300, and then a large open room, like a living room opening up into a dining room or something, would be over 300 CFM for the CADR.
Thank you. I know the CFM and CADR, the air cleaner device, all those acronyms, it is hard to keep it all straight in your mind. Thank you. I also recommend folks follow the link in the chat to the air cleaner device resource page from RAMP. It's really valuable. There's a lot of detail in there. A lot of you in the audience have had questions about specific air cleaners. And I will ask you, was there a specific air cleaner you used in this pilot? And was there a reason for choosing that particular cleaner?
The Bay Area Air Quality Management District led the process of selecting air cleaners. And rather than naming the particular manufacturers and models, I think I can share information about what criteria they used. So cost was a huge factor, obviously, of not only the unit itself, but replacement filters, because one thing we really quickly learned was how important it is to provide replacement filters to the families. They also looked at the size, weight, the size of the room, where it could clean the air. There were some factors related to the process. Would the manufacturers be willing to send small amounts on a regular basis to those asthma programs that just don't have the storage to store a lot? So they developed criteria. They had a review team. They went through that process. And I think what's notable is that they provided multiple options. And I think that is important, both for the size, making sure that you can try to get the size right where it will be used. But also the community health workers know a lot about the families that they're working with and what's going to be important to them. Do they need a child lock? Do they need it to be lightweight because the child spends a lot of time at multiple houses and they want him to be able to bring it with him? So we thought that providing multiple options was important.
Thank you, Anne. And to those in the audience who are asking questions about very specific models and manufacturers, we won't be answering those questions on this webinar, and I'll keep encouraging you to the link for many of the reasons Anne just said. We can't make the perfect answer for any individual on the webinar, but so excited that we can offer the resource RAMP has made available so you can look at it and look for different air cleaning devices. And now to a slightly more complicated question, Anne. A lot of folks in the chat were just talking about, whole building solutions with heating, ventilation, and air conditioning systems that we can outfit with, say, MERV 13 or HEPA filters. And MERV 13 and HEPA, for everyone in our audience, it's a grade of the fine mesh of the filter itself and how much particulate matter can a filter be expected to catch. There's a lot of issues having to do with filters fitting and being commissioned correctly for the HVAC systems they're in. That's why I say, Anne, this is a tricky question. But folks were asking, should we be looking to enhance filters in HVAC systems, or if we have an HVAC with MERV 13, do we still want to also think about air cleaners? And I just wanted to introduce that question to you and see what you thought. And others on the call, please also feel free to
jump in. Yes, absolutely, to thinking about building level solutions. what we found in conversations with many of the asthma programs is that most of their clients are renters and didn't have the ability to think about the entire building's HVAC system or to control that. And so providing them with a unit for their apartment, or even smaller for their child's bedroom, was the right solution for them at the time. But absolutely, the filters on HVAC systems are really important. I'm not a building specialist. There are people who are, that can talk about airflow rate and which ones you need. But I would say absolutely, if you're a homeowner or a renter with a good relationship with the landlord, exploring that option is very important. Whether to do it in also, if you have one on your HVAC system, do you also have an air cleaner in the room? I do in my house. I think more filtration is better.
And let me invite our friends from Montana. I know, I hesitate to ask you too much about what you're going to do with your wildfire grant that I know you just got, and you're still planning a lot of your work, but some of what you're thinking about looks like it is facilities level whole building interventions to create safe central spaces. And I wonder what you're thinking about as you approach this question of portable air cleaning devices or whole building intervention ideas. And I invite you just to, share with us what you're thinking and what you're exploring, because I bet a lot of us in the audience are right there with you in this thinking.
Yeah,
Jay, why don't I start with you?
Oh, sure. Thank you. I'll hop in, and then Mary, if you have anything to add, please feel free to kind of fill in where I may have missed some pieces. So from our perspective, we are looking at working with public buildings. And so when we look at this, these target buildings on this larger level, portable air cleaners are certainly a part of that strategy, but they're part of a larger strategy that looks at their HVAC system, and bringing in engineers, HVAC professionals to do some kind of an assessment there and see what the capabilities of that system are for increasing filtration, whether that's getting to MERV 13 or higher filters during times of poor air quality, but then also supplementing with those portable air cleaners. And another part of that is using indoor air quality monitors, which is kind of a newer practice, but really trying to include that as well as a decision-making tool that they can use to say, okay, well, maybe our air quality isn't so great right now. We see outdoor ambient air quality is starting to deteriorate, whatever the situation might be. And being able to look at their indoor air quality then and decide, do we bring in those larger air cleaners? What are the criteria that we need to decide when we're selecting those different air cleaners? Like Anne mentioned, noise level, some of those safety features, especially in those public buildings. So safety, security, and things like that also go into those decisions when they're choosing to employ those or not. So it is part of that larger strategy. And Mary, if I missed anything there, feel free to add. But I think here, I'll mute myself.
Okay, there we go. Took me a minute to unmute. Thank you. Yeah, so BJ is our big picture person, and he knows way more than I do about the science of particulate matter and the cleaners. And so I'm on the ground working with our different partners and finding partners for these counties. And so we're beginning with, for Montana, one of our largest counties, Missoula County, and then Ravalli County, which is right next to it, but is very, very rural and very different as far as resources. So it's been interesting because in Ravalli County, for example, we're looking at libraries, public buildings. One of the things that we were told very early on was that you want to find buildings that people want to go to. So you can go to a community building, and if there's nothing for them to do there, then people aren't going to go there anyway. So it's been nice to partner with different libraries is really what we're looking at. And so one of the libraries we have is a lot newer, and they have a lot of resources already. And so as we provide air cleaners and monitors, that's going to be enough for them. I was on a call earlier today with another one that is an older building. Some of the floors rotting out in the building, but that's the largest building in Stevensville, Montana. And so we are looking for they have a community room that we're looking at using, and then just trying to figure out what that capacity would be. But it was very interesting because the director of the library, and again, it's a very small community, said, I don't know, if this is going to work, because we have children's activities in this room too, and we have this. And we talked about how that could actually be an advantage. That's respite care for our kids with asthma, and there's an activity going on. So when we promote that there's 2 hours there, and she's like, then I could put maybe a senior activity in the afternoon. So we're really looking at creative solutions for really respite time for them, with the people who are already doing that. That was the biggest thing that I've gotten out of my meetings with the people who've done indoor air, is that it has to be something that people are willing to go to. And so those libraries, we have internet there, we have enough chargers, we have rest air rooms, they're accessible for those with disabilities. And so all of those things, as we started looking at our buildings, things that we had not considered started to be issues. And so we're really looking for buildings people are already utilizing that may have some resources, and then we're helping them find grants to do the rest. So
thank you, Mary. That is really good insight and very helpful, because if we all, are just thinking about, well, where's a big enough building and where can we get the HVAC to work right, without thinking about why were people going to come and be there, it's not a solution. That's very helpful insight. Thank you. I'm just going to come back to Anne with a couple of questions, but we're going to keep this conversation we have going now. And I'll just tell you all that in the chat, the folks are blowing up the chat, and so that the audience knows, I'm doing my very best to monitor the chat while also listening to our panelists while thinking about what I'm going to ask next. So if I don't get your question that you're asking in the last couple of minutes, it's because I was listening to that very great answer. But there are questions about air monitoring and your advice about monitoring air quality outdoor and indoor. There's some specific questions about schools, and what do we think about protecting students at schools. So any of those ideas you have, I invite. But first, Anne, there's a question about, and I think I know the answer, but I want to ask for the audience. There's a question about, were you able to see ED and hospitalization effects post air cleaner distribution? And did you collect personal identifying information such that you could follow that loop through? And I'll mute and wait your answer.
Unfortunately not. That was not part of the budget for the program, for this pilot program. The Air District allocated funds just to purchase the air cleaners themselves, not even for any additional staff time, not for the programs that were providing the air cleaners. It was really just to pay for more air cleaners to get out to more people. And so unfortunately, no, we don't have any outcome evaluation data. The only data we have are the de-identified information around who received the air cleaners based on race, ethnicity, age, primary language, and zip code where they live. So I think a follow-on project to look at that would be fantastic.
Yeah, my mind is running on how to design that follow-on project right now, so I have to get refocused here. So for all of you, let's talk maybe a little bit about schools and school buildings and how we think about schools with the conversation we're having about preparing facilities for wildfire smoke events, children being among the most vulnerable groups, children with asthma, excuse me, and thinking about facility interventions. Have any of you started to work with or think about school spaces and want to share anything with us? Mary, why don't I start with you, because I know you have a background in schools, but I think you're muted.
Okay, yeah, I was looking at BJ because he actually was part of a program in Montana.
Okay,
Through some of the COVID grants. So I'm going to let BJ talk about his program, and then I'll come back.
Sure. Thanks, Mary. Yeah, and so I guess I would say for this project, and then even well, maybe I'll start by saying for this project, we're focusing on these 3 different levels, like building level, community level, and then schools is kind of an offshoot of that as well. And that kind of falls under that building level, but it's a whole other beast. And so when we think about that, they're part of our kind of targeted work that we're trying to do with publicly accessible buildings, and trying to go through this kind of clean indoor air recognition program. So I'll just say that up front. But we've had an in there with schools over the past several years. Fortunately, unfortunately, through the pandemic, we were able to get out over 10,000 portable HEPA air cleaners to our K through 12 schools, and then a small portion of childcare education centers as well. We were able to use federal school reopening funding to assist with that effort. We don't have a lot of outcome information on that at this point, but we are in the process of doing some follow-up surveys and trying to find out how those are being used in the school, because we've heard some varying reports about some of those, if there hasn't been a lot of that education or interest in using portable air cleaners in the classroom, those get pushed off to the side, put back in storage. And so we are in the process of trying to figure out how those could be maybe repurposed or used in the school, but if they're not going to be used, how they can be repurposed in the community as well. So that was one really great project that we were able to capitalize on. One other thing that we've been able to do here at the policy level in Montana is implement some school administrative rules through our Department of Public Health and Human Services here that require schools to have a protocol in response to poor outdoor air quality, specifically wildfire smoke, but there are other things that could, inversions here in Montana certainly can cause poor air quality as well. So so that is something that schools have to have in place. They're also now required to do annual HVAC inspections and a walkthrough, an indoor air quality kind of walkthrough in the school. And we don't handhold or we don't monitor their every steps on that, but we try to leave that to schools and their local control to decide how to best do that. But they are required to have those policies in place. And I think one other thing that I maybe should mention out of those rules as well is having a integrated pest management program as well to try to reduce possible exposure to pesticides and things like that. So there are several little pieces as part of that kind of administrative rule overhaul a few years ago that have really focused on improving indoor air quality in schools. And I'll turn over to Mary to
Yeah, I'm going to turn it to Mary. I just want to point out to the audience where we have questions about schools, where there are some questions about shouldn't all schools be required to have, XYZ. If you hear in BJ's answer just there, you can hear the levels of authority over what schools are required to have. And so as you listen to the example in Montana, you can hear how requirements for school indoor air quality were advanced. It sounds like legislatively through the assembly. Am I hearing that right, BJ? That went through your...
That's pretty close, Kate. So it's actually through our department here. We were granted authority several years ago in through the legislature to implement administrative rules that oversee matters of public health in schools. And we do have to be careful here in Montana about how much, I wouldn't say overreach, but just how much we do there, because we are a local control state. And so we want to respect that local control in schools and give them the tools and resources to accomplish and to accomplish these different, I guess, requirements or tasks that we're asking of them, but not overburden them at the same time.
I could really hear that in your answer, and I wanted to draw that out for the audience so our audience asking would understand this is a local issue, and how to make things happen in your schools has probably got a local path. And I was just underlining, and thank you, BJ, for that. And Mary, let me turn to you now and hear what you were thinking about with schools or other facility building.
Okay, thank you. So first I'm going to say this as you had alluded to that earlier, Katie. When I worked in schools, we really didn't know anything. Even into COVID, we all of a sudden these cleaners showed up at our school, and we really thought we used them during COVID. Had not thought about wildfire smoke or indoor air really until I got this position. What I knew was that we just prayed for that air quality number to stay over 150 so we didn't have indoor recess. I mean, that's all I cared about. I didn't care about anything else. I just wanted those kids outside. So I really do believe that education needs to happen around this, wherever we can do education. So for those of you who are out there, people don't know. So when these rules come down, or it needs to get to the grassroots, and so part of one of the toolkits that I'm working on right now is a school toolkit that will have that has a template, an email to teachers. Here's why we're doing this. This is what the air quality is. This is what I need you to do in the classroom. Here's some lesson plans so you can talk to kids about indoor air, because our kids are going to be the ones who are going to be telling their parents about it. And even we put together, there was some extra monies in a different grant. And so we put together some training kits to go to our first 2 counties. And the Department of Natural Resources is taking care of this in Ravalli County. We have a non-government organization that's going to do it in another county, where they can go in and make box fans with kids and talk to them about indoor air, and here's something you can do at your house to help with indoor air. So I think before we do anything with schools, that education has to happen. I do know that those cleaners that BJ talked about, Colorado also had grant money, and those cleaners are in their schools as well. They're doing the same survey that we are. But I guess I'm starting with that to say, first of all, I think education, anytime you can talk to people in your community who are willing to go into schools, you need to be doing that. With the cleaners that we have in Missoula County, there's a parent who knows about indoor air. And they said, oh, our schools have cleaners because they're not in our classrooms. Well, they're finding those, and they're getting a parent from each school, from their PTO, who's going to go in and change the filters, because they didn't have anyone to do that work. So so I think it takes a village. I guess the big thing is this is going to take a village, but I do think there's solutions for schools. The other thing that we have here is the Department of DEQ is working with the University of Montana, and DEQ, we have 20 monitors for the entire state. And so the state of Montana is so big that you can drive for a day and not get through it. So we have $20,000 monitors, outdoor air quality monitors. And so what DEQ has done is they've purchased other monitors and are having schools place them on the outside of their buildings. And we're using those for our monitors for our outdoor air quality. And they are pairing those with this University of Montana grant to provide indoor air monitors if the schools want them. And there's contracts that say they're not going to publicize that indoor air quality, but it's a way for schools to start monitoring that air. But there's a lot of opportunities if you don't stay in your own world to work with other people, because Department of Environmental Quality is doing work. A lot of research is happening just in Montana. Montana Tech and University of Montana are doing a lot of work. MSU put together a bunch of public materials for schools. So I think that you have to get out of your area and see what other people are doing, because none of us can do this work by ourselves. So if you stay in your asthma world, you're not going to get there, and the people aren't going to get the information. If you're willing to start looking and seeing who else is doing the work. I've been here 2 months, and I have contacts all over the state. Emergency management said, hey, what can we do? If there's a large smoke event, can we put together a mobile unit so we can bring in more air cleaners in a large event? And that was one phone call. So I think the biggest part is to get to know who else is out there and who else is concerned. And so
I love your
That would be
answer.
my big
So terrific. And it's so, it reinforces so many things that I think EPA's asthma program talks about all the time. And both everyone talking today has illustrated so well that, you know, each of us can see some piece of this story, but there's always bits of it we don't understand, and we may not understand what others do and don't understand, and making the connections as all of you in the chat are doing. And, you know, I'm so sorry to those in the chat that I can't get to each question you're asking. They're really wonderful questions. You know, we have questions like, shouldn't we be talking about outdoor air and what we're going to do to manage Canadian wildfires before we get it? You know, shouldn't we be talking about ambient sources? Shouldn't we be talking about air quality monitoring? And I do actually want to invite Anne to help us back up for a minute and think, Anne, wildfire preparedness for asthma. I mean, you emphasize partnerships and having partnerships unusual in place. We've all emphasized this need to make connections for folks in schools. They may understand asthma, right? I mean, Mary said, yeah, sure, we've encountered children with asthma all the time, but making the connection between asthma, a wildfire smoke event, risk in the school, indoor air quality management, absenteeism, you know, funding that goes based on seats and seats filled each day. These are connections we need to help make for folks. And so, Mary, everything you said was, yeah, it was almost like you were primed to really push the partnerships and collaborations button, because that's the key. But Anne, I do want to address this question in the chat, and this is really for the whole group of us. We're here talking about indoor environmental determinants of health and how indoor environmental interventions can be, as Tracy said, emergency medicine in a wildfire smoke event. We haven't talked a whole lot about the outdoor air and monitors and signals and outdoor air monitoring. Mary touched on it a little bit, but what else we might think about and respond to in the outdoor air as we're putting together these indoor environmental preparedness packages. I don't want to miss the chance to highlight some, you know, air quality index issues and other things we tell our friends who run asthma programs. So I know we can't solve all of the outdoor air causes of wildfire, et cetera, right now, but maybe you all can share with me, who do you partner with on outdoor air, and what would you counsel our asthma programs as they get ready for wildfire emergencies to think about in terms of outdoor air signals, monitoring, partners, et cetera. And Anne, I'm going to start with you because I know you've worked with the Bay Area Air Quality Management District for a long time. And that's, I know that's a way into this conversation. Thank you.
Yeah, thanks. I mean, it's, I think underlying your question is the sort of very real and large truth that wildfire smoke is only one component of air pollution that is significantly impacting people with asthma, as well as everyone, both indoor and out. And you know, there are many factors contributing to that poor air quality, and most importantly, contributing to the inequitable distribution of air pollution. And so, you know, looking at where the diesel trucks going, where are the stationary sources like industries that are creating air pollution, what protections are being taken at port communities to keep the pollution from the residents that are nearby and significantly impacted. And so I think as asthma organizations, it's very important that we stay engaged in those issues, that we partner with environmental justice advocates who are really looking at the inequities underlying that excess air pollution, and really recognizing that wildfire smoke is important, but it's just one piece of the broader air pollution that is going on, and that we need policy and systems change to address that. So they're separately from that, but related. Air quality index. I think it is so important to educate people about what the air quality index means and how to look at and understand the data. So the airnow.gov website is fantastic. And when we're looking at it in a place like the Bay Area in California, you see, you know, many of the federal monitors, you know, that are sort of the highest quality of monitor located different locations, and you can see the exact readings on those. And then there's all of the lower cost air quality sensors that in a highly dense, in a densely populated area, you have a lot of those as well. And so AirNow takes all of that information and puts it on a map for you to understand, not only what is the air pollution at a particular point in time, but how does it look like it's moving and how is it changing over the course of an hour. And it can provide some really useful information for individuals and families, but also for schools and youth sports groups and, really these entities that are trying to work together to make tough decisions during wildfire smoke events. So I think using that tool and educating people about it is really critical.
And BJ, can I turn to you and just invite any thoughts you have on that? It's a broad topic, so anything you have on the mind and you're thinking about in Montana for helping make people aware of the outdoor air as well.
Yeah, I think Ian did a really good job of kind of summarizing most of my thoughts I would have had on that. Here in Montana, we do work with our Department of Environmental Quality that Mary mentioned. They're probably our closest partner, and they do control those federally operate or funded monitors, and then the kind of high quality monitors that they have. So we work closely with them to make sure that if there are any spikes or anything like that, that we're trying to communicate that to the public. It doesn't happen often here in Montana, again, because of that geography, but we do have some areas that may have been considered maybe non-attainment areas in the past for different things, whether it's particulate matter or ozone or some other contaminant. So we try to stay in touch with them on a kind of normal basis as often as we can. And then what we really try to do, whether it's through our outdoor activity and air quality guidelines table, we try to give recommendations for the general public on how, again, to interpret those AQI readings, and then kind of what that means for their just general day-to-day activity and different levels of activity. And so pointing people to those, and then reminding people that the airnow.gov website's out there, and then here in Montana is todaysair.mt.gov as well, that can help link people to not only our health resources, but then whether it's DNRC or some of these other governmental partners, or I think another one for us is the Department of Commerce. And so for tourists that are coming into the state, just thinking about, how do they change their plans or plan ahead in case we do have poor air quality? How can we direct people to indoor locations where they can still enjoy some Montana history and some things like that, and enjoy the state out away from that poor air. So.
Thank you all very much. I can't believe we're already used up all of our time, but we did. There are so many more questions we could discuss. The chat has been very rich. I encourage my colleagues who will be compiling the recording for this webinar to make sure you check the chat. There's a resource from the Minnesota Department of Public Health. It's a resource on wildfire and asthma. Let's make sure we share that out when we share the recording. I want to just say to folks that I know when providers, like clinical providers, are talking to individual people with asthma about preparation, they always say, watch the air quality index, pay attention to AirNow and whatever the state's version of AirNow for local data is, and be prepared with N95 masks. These are hard counsels to give, but these are sort of what we can always tell anyone to help in these situations. And thank you so much. I want to turn it back to our host at US EPA, Tracy Mitchell, and just thank you both the new wildfire grantees and Ann Kelsey Lamb and RAMP's amazing work. Thank you for being so generous and sharing with us and our audience today. And Tracy, thank you for inviting me to facilitate that really fun panel.
Oops. Well, thank you all. Yes, I'll just echo what Kate said. This was amazing. We are at time, but I want to just quickly, the vast majority of our participants stayed with us, hung in there the whole time. And so we do have the final polling question that I warned you all about at the beginning. So if you would take just a moment, open up that poll, and let's take a look at how we did today as we revisit the poll to kind of assess how we did with meeting our learning objectives today. While folks are doing that, I'll just again say thank you to BJ and Mary from Montana. They are one of 9 recipients of the Wildfires grant that the Indoor Environments Division recently awarded. So we look forward to hearing about their work as they continue to build those partnerships and work on the proposal that they have been awarded for. So let's go ahead and close that poll. So a nice jump in folks feeling a little more comfortable and understanding about wildfire and asthma efforts. It looks like, and a nice jump in somewhat familiar. So very good. I appreciate everyone taking the poll and giving us some feedback. Looks like we did a great job. So you all mentioned many resources. I was going to jump in, but I knew that we had these resources from EPA to close us out. So I'd encourage all of today's participants to check out the resources on EPA's website, more about air cleaners, more about outdoor air quality, how outdoor air enters the home, and things you can do. So we will make sure that we provide these resources post-webinar. And then I just want to encourage folks, remind you that today's webinar will be archived on AsthmaCommunityNetwork.org. And this was the third of a 3-part series on technical solutions and indoor environmental determinants of health. So if you're not already a member of AsthmaCommunityNetwork.org, please join so you can have access to not only past presentations, but then you'll get notifications for upcoming webinars and all of our newsletters and all of the information we have on indoor environmental determinants of health, asthma, and it's a great way to share, learn, and connect with other programs across the country. So with that, we're just a couple minutes over, but thank you all again, and that concludes today's webinar.